Okay, I'm Kelly McCosh. I'm a physician assistant here at Central Maine Pulmonary and Sleep Medicine. And today we're just going to do a little introduction to our office here, what we do, and mostly the medications used to treat some of the diseases we see here in the office. I see patients on a daily basis here in the office with a variety of pulmonary conditions, including asthma, COPD, pulmonary hypertension, pulmonary nodules, and do a lot of patient education. There are a lot of medications, as you can see, out now to treat asthma and COPD, and so it gets a little bit confusing. There are inhaled steroids, long-acting bronchodilators, of which there are two different kinds. There are short-acting bronchodilators. There are new combination products, old combination products. So we're going to do a rundown of some of these inhalers and how they work and why they're important. These inhalers are very important to take regularly. Just like any other controller medication that you would take for your diabetes or high blood pressure, same idea here. A lot of these inhalers work to reduce inflammation in the airways, and then they work also in a 24-hour period as a bronchodilator to keep the airways as open as possible in that 24-hour period. If you miss a dose, you want to take it at your next scheduled time. And I always tell my patients the ones that are twice a day or even first thing in the morning, you want to keep it by your toothbrush so you remember to take it. So morning and night when you brush your teeth. Very important to take these regularly. And when you go to reach for your rescue inhaler, you can feel that kind of instant relief. The other inhalers, the maintenance inhalers, you might not necessarily feel anything dramatic after you use it, but it is doing the job. It's doing what it's supposed to do to keep your airways open and reduce inflammation. So even though you might not feel a dramatic benefit, it is beneficial. And we'll usually see that when we measure your lung function. We'll see the improvement after you've been on these medications. And also important to keep in mind that some of these inhalers do take a while before they really start to work. So again, stressing on the importance of taking them regularly, and then we will see the benefit. We want to make sure that our patients get these medications. If you're having trouble with the cost of these, you definitely want to give our office a call and we'll see what we can do to work with you to get you these medications. So a lot of patients come in very concerned about the commercials they see on television with regard to these inhalers. Many of them have inhaled steroids in them. The inhaled steroids are much safer than the systemic steroids, so like taking prednisone. The only thing really to bear in mind with the inhaled steroids is you want to rinse your mouth good after so you don't get thrush. Otherwise, these are very safe, tolerated well, and we can talk to you in detail at your office visit about the particular drug that we recommend for you and the potential side effects. These inhalers are not interchangeable. When we do a consult here, we're going to decide based on your history and exam which one we think is going to be the best for you. And if you have any questions whatsoever about the inhalers, which one might be best for you, we just ask that you bring that up to us at your appointment, and we'll make sure to answer all of your questions here.